Doctor, now I want to explore the other side of the story. Has a patient ever delayed coming to you because ChatGPT told them it was probably nothing serious?
I think the AI-enabled platforms, and they call it ChatGPT for the sake of simplicity, are truly more and more, getting more and more accurate because they ask a number of questions. I have my own experiences around this. I also have been on ChatGPT for one of my relatives who had a problem and who had a serious problem. And I wanted to know more about it, and I wanted to know about how to go about it because it's not my domain, it's not my knowledge. It's a condition and a specialty which is totally alien to me. And I got so much of information because the ChatGPT took me through more information, wanted more accurate information before suggesting anything, was taking me through all the possibilities, and finally said, it'd be much better that you see a doctor as soon as possible.
Doctor, in the last few years, we have seen that young Indians are having heart attacks at 30, 35. They are also the most likely to consult ChatGPT first, as you also pointed out in the conversation earlier. Doctor, what is your message to that particular demographic specifically?
Yeah, I think you raise a very important point. See, every time we have kept emphasizing know your risk factors and understand how to control them in this world. We as Indians are prone to heart disease, especially in the young. And I therefore want all youth to consult ChatGPT for their risk factors. And all you got to punch in is, I'm a smoker, I'm a diabetic, this is my age, my father had a heart attack at this age, what's my BMI? What are my habits? And it'll just keep asking that. And by the way, it'll bring out, literally, tell us exactly what to do. And we here, by the way, waste time to try and get a doctor to tell us that we're going to take care of our risk factors and how. Well, prevention. The ChatGPT tells us very accurately. It actually analyzes, it actually tells us even when the statins have to be used. It also tells us that we're at a high risk, see the doctor. But importantly, can you believe that it talks on all matters and doesn't disregard anything because it goes by the guidelines?